My name is Camila Martinez, and this is my presentation on breast cancer awareness. What is breast cancer? Breast cancer is a type of cancer that starts in breast tissue, usually in the lining of the milk ducts or the lobules. Breast cancer is malignant, meaning it can grow uncontrollably and spread to other parts of the body. There's multiple types of breast cancer, one being ductal carcinoma in situ, invasive ductal carcinoma, invasive lobular carcinoma, and triple negative ER2 positive subtypes. What breast cancer does to the body. Breast cancer cells divide uncontrollably, forming lumps or masses. The spread of breast cancer can cause the cancer cells to invade other parts of the body. This includes cancer cells to spread to lymph nodes and other organs like heart, liver, bones, or the brain, which can be terminal. Symptoms of breast cancer can be breast changes, nipple changes, skin changes, and there's also fatigue, weight loss, nausea, and headaches, bone pain, swelling in the legs or abdomen. Risk factor and causes. Breast cancer doesn't only have to be genetic, it can also be hormonal factors and lifestyle factors, environmental factors, and age factors. If it's hormonal factors, this can be seen in early menstruation and late menopause, hormone replacement therapy. Based on lifestyle factors, breast cancer can be caused by obesity, lack of physical activity, alcohol consumption, and or smoking. It can also be caused by radiation exposure, and breast cancer increases the risk with anyone over the age of 50. Who breast cancer affects. Although breast cancer is very common in women, breast cancer can also affect men. Breast cancer is the most common non-skin cancer diagnosed in women. 1 in 8 women will develop breast cancer in their lifetime, and the risk of getting breast cancer increases after the age of 50. Men can also get breast cancer, but about 1 in 1,000 men will develop breast cancer in their lifetime. Men with a family history of cancer can develop breast cancer, and men who have been assigned male at birth and have been taking hormones for longer than 2 years have an increased risk. Breast cancer leaves an impact on patients. This impact can be physical, psychological, and financial, and can also disrupt someone's lifestyle. Based on the physical impact, patients can develop pain, fatigue, and nausea from treatment. Patients can also develop menopause-like symptoms from hormone therapy and scarring and loss of breast tissue from surgeries. With the psychological impact, patients can develop depression, anxiety, fear of reoccurrence, body image, and self-esteem issues. Based on the lifestyle disruptions, patients can depend on others for daily tasks and reduce ability to work or care for family. Breast cancer leaves a financial impact on patients by the loss of income from time off work and the cost of treatment and medications and follow-up care. Breast cancer doesn't only impact the patients, it can also impact the patient's loved ones. This can cause emotional stress, road changes, financial burden, and need for support. Patients' loved ones can develop grief, fear, and helplessness among family members, and they have an increased risk of depression and anxiety in their caregivers. Patients can also cause a financial burden due to the out-of-pocket costs and lost income from caregivers. It is important that the family of the patient's loved ones receive psychological and emotional support. The chances of developing breast cancer can be prevented by getting early detection and screening. This is important because breast cancer that is found earlier is easier to treat and has higher survival rates. Some methods that can be used will be self-exams, clinical breast scans by doctor, mammograms, and ultrasound or MRI for high-risk individuals. Some guidelines of these screenings will be women age 40 plus should discuss mammograms with the doctors and early and more frequent screening for high-risk individuals. Some treatment options for breast cancer would be surgical treatment, radiation therapy, chemotherapy, and hormonal therapy. Some other treatments also targeted therapy and immunotherapy. A surgical treatment can be a lumpectomy, a mastectomy, and radiation therapy targets and destroys cancer cells in specific areas. Hormonal therapy blocks hormones that fuel cancer growth, and targeted therapy are drugs targeting specific characteristics of cancer cells. This was my presentation on spreading breast cancer awareness. Thank you for your time.